Okay, so now I'm gonna start. So good afternoon. So I'm very honored to have this opportunity to present today. I have been conducting research on self-management among the patient with the chronic disease, including liver disease. But there are few researchers in field of nursing focused on the health issues of a patient with the liver disease. So I hope this session will serve an opportunity for the nursing scholar to take a greater interest in this population. So my topic of my presentation today is health aging among people with the liver disease. So I will gonna discuss the health aging in patient with the liver disease and present our finding of my research. So okay, this is the outline for the presentation. So what is the health aging? Theoretically, the health aging is identified as a lifelong process, and it is multi-dimensional concepts such as social, mental, and physical. Importantly, the health aging is not only concern for the older adult. Intervention in middle age can increase the number of years lived free of the chronic disease. So for the nursing researchers, this framing is to highlight the need for the interventions that address the physical function, psychosocial factors, and social determinant over the life course. So I have been exploring ways for the people with the liver disease to maintain their health and improving their quality of life as they reach old age. Globally, approximately 2 million people die from the liver disease each year, accounting for about the 4% of all deaths and the length as the 11th leading cause of death worldwide. About two-thirds of these deaths occur among the men, indicating a significant gender disparities. In particular, the liver disease imposes a significant socio-economic burden by causing disability and the loss to productivity among the younger population. This perspective of nursing researchers, the priority should be given to early screening, integrated care, gender-specific researches, and the study on the functional reservation, rehabilitation, and cost effectiveness. The MASLD is the renamed, it's the 2024, that replaced the old term non-alcoholic fatty liver disease. The change is aimed to avoid overemphasize alcohol and to remove the potentially stigmatized the words of the fatty, while highlighting the central role of a metabolic dysfunction. So MASLD described the fatty liver in the presence of one or more metabolic cardiovascular risk factors. So although MASLD itself rarely causes of death directly, but it is a major driver of the liver-related mortality by increasing risk of liver cirrhosis and hepatocellular carcinoma. So, and its prevalence is interesting. Its prevalence is rising globally, and the MASLD is increasingly recognized as a contributor to frailty and sarcopenia. Moreover, the achieving cure is a difficult task because there's no disease-specific treatment like medication for the MASLD. So there is some new medication has been developed and some have been applied in clinical, but still they remain uncommon and have not been widely adopted. So the lifestyle modification is known to be a key factor in improving health outcome of these patients. So as a nurse, I consider this aspect to be more important than for the subject with other health issues improving their health status. I will say why the MASLD the matters for age. The although MASLD is common in older adult, but its prevalence in the older population is a prevalence often the fall with the advanced age. And that can reflect they call the survivorship bias, which is people with a severe muscle D or related complication maybe die or drop out before reaching the old age. So older cohort can look healthier than they truly are. And older patients the MASLD promote the frailty and sarcopenia, but its effect to go beyond the liver. So it's worsening the metabolic health, reduce the physical function, and is shaped by social determinants. The MASLD is tightly linked to the functional decline and social disadvantage in older population. So identification and management in middle age are critical to prevent downstream the frailty, disability, and adverse the aging outcome. So since 2011, I have focused my research on improving self-management in the people with the liver disease, including the muscle D. So the people with muscle D they face the several challenges. So many patients are asymptomatic until late disease stage, and which is weaken the perceived urgency for the behavior change. So they frequently access the mixed quality information and may lack skills for the sustain the lifestyle modification. So even when individuals know that the lifestyle challenges are needed and the translating that the knowledge into the sustain the behavior change is difficult. So and also the compounding this, there's no validity in instrument to measurement method specific self-management in that time. So this gap convinced me that tailored evidence-based intervention are essential. So first, I believe that the measurement scale was needed to assess the level of self-management. So I developed the first stage. I developed the called the method NAPLD SMQ. So based on this result of the result of previous my studies, I learned that since the majority of patients with the liver disease are middle-aged men, rather than women, the role of family members, particularly spouse, is crucial. Uh, the crucial in helping them to change their lifestyle behavior. So particular, I found that why the middle-aged Korean man is very independent in their social activity. However, they rely on their spouse for the manage their diet and exercise like the has promotion behavior for the sake of their health. So furthermore, this group has the lowest study participant rate. It is very special. They have a very special population. So since it is necessary for family to participate together in self-management, I incorporated this element into the scale based on this in the individual family self-management theory. This scale that consists of total 22 items and in organized into the 6 domains, such like diet management, medical treatment, management of medication and dietary supplement, the alcohol consumption, and sleep and family support. So, and then this slide outline my the Smarter Liver, the self-management intervention program I developed for this group. The goal of this intervention was the weight loss, improve the self-management skill, and reduce the fatty liver level. So based on IMB model, this intervention consists of providing disease-related information, guiding dietary exercise management, and offering support for the self-management activities. The Smart Liver consists of 4 sessions, and which is the word the self-monitoring through the dietary, exercise law, disease-related information, regular coach, and then feedback via the text message. It was provided over total the period of 6 months. So we developed the mobile application for the disease intervention. Since keeping a food diary was the most challenging aspect of a participant. So we created a way to take the process easier. So when participants took a photo of their meal using the AI camera, and app automatically analyze the type of food and their calorie count. So while there is some error, but it generally works well with the Korean cuisine. So this allowed the participant to review themselves and then improve their eating pattern together. So in addition, we prepared the monthly report on diet and exercise and share them with the participant. During online meeting, the researcher reviewed and adjusted established the goal and educating each participant to help them achieve their individual objectives, individual goals. So the following intervention in participants generally achieve the positive health outcome. However, during this study, I learned that even within the intervention group, there's a certain level of adherence to the program and participant rate was necessary to bring about the change in health outcomes. Furthermore, while this study did assess the family support, but the intervention was a participant centered. It's like an individual. We focused on individual things. So we found that participants who achieved the positive outcome had a family that were actively involved. So uh, the previous studies have reaffirmed that the family involvement played a highly positive role in improved the health outcome of patients with chronic disease, even in this population as well. So maybe we already know the family serve the source of information and assist with the lifestyle modification and monitoring and contribute to mental well-being. The replacing this finding from this previous study, the present study, this study was I designed another study to involve the family intervention and modify the participant health behavior. This intervention, the period is total of the 3 months. And then its primary object was also to modify the participant health behavior. But this intervention differs from the previous study in that it is specifically targeted the middle-aged man patient with involved the family participant. So previous study has shown that the modifying the lifestyle, the behavior of the middle-aged man the patient was more difficult and had a lower compliance rate compared to other population groups. So which is why I choose the focus on exclusively on this group. So data collection for this study has been just complete. And the results are currently being analyzed right now. So preliminary analysis indicates that participants with high family participant rate demonstrate more positive outcome than other participants. So in particular, the participants who work to change their lifestyle behavior together with their spouse, especially spouse, they show even the greater improvement in this study. So looking ahead, I propose the research topic that directly relevant to nursing science. The first is in development and test tailored intervention strategy that incorporate the individual symptom profile, family context, and the lifestyle pattern use of the patient reported symptom data to adapt the intervention intensity. And then second one is development. Oh, I'm sorry. Yeah. Development of a multidimensional outcome indicator that the combined the subject metrics with the objective metrics and the subjective outcomes such as the symptom burden or quality of life. And then third, then development of study strategies to ensure long-term maintenance of a healthy behavior, like a booster session and automatic adaptive feedback and integrate into the primary care workflows are promising approaches. So from a clinical perspective, the nursing researchers should prioritize the implementation science. So how to scale validated self-management instrument and family-supported digital coaching in diverse healthcare setting, and how to training nursing staff to deliver and evaluate this intervention. So in summary, the MASLD is a multi-dimensional condition that and threaten the health and aging through the metabolic dysfunction, sarcopenia, and functional decline. So multidimensional aspect scale, such as NAPLD SMQ, and then theory-driven digital interventions, such as the MIND study, and then especially when the combined with the family support tool will offer the pragmatic way to improve self-management and potentially alter aging trajectories. So for the nursing researcher, the opportunity to refine these interventions, to validate the meaningful outcome and study sustainable implementation strategies. Okay, thank you for the attention.